Hi, my name is Mary O'Dwyer. I'm an infection prevention and control nurse, and I'm part of the infection prevention control team here in the community in the Midwest. I'm aware that some of you here today watching this are working in nursing homes and in various settings, but I'm going to first of all go through probably standard precaution use of PPE. So firstly, of course, you go bare below the elbow, and I am now going to show you how to use standard PPE. So first of all, hand hygiene as ever is done firstly, and we'll talk about this, we'll go through the steps later, but just for now, just be aware that you do need, before you put any gloves on, if you're using gloves, if there's a bodily fluid exposure, you need to do your hands first with hand hygiene. So your hands need to be dry when you're putting gloves on and putting PPE on. So the last thing you put on when you're going to somebody is the gloves, okay? So the first thing I'm going to put on when it's just a gloves and apron situation is an apron. And an apron is a single use. All of these PPEs are single use. So we put on our apron, we're bare below the elbow, and now if we're changing a catheter bag, emptying a urinary catheter bag, we need to put on gloves. And again, when we're taking gloves out, you have to be mindful of the fact that we don't want to be touching the fingers of the glove, because then they're contaminated before we even start the job. So gloves are not just about protecting us, they're about protecting our patients. So we put on the gloves. You never keep gloves, by the way, in your pocket, because they're getting contaminated with phones and money. So gloves are never stored in your pocket. They always come fresh out of the box. And you put on gloves at the bedside, never out in the sluice or out in the corridor. They're the last thing to go on. So if I'm going in now to empty a catheter, I'm actually in the room at the patient's bed before I put on the gloves. They're not put on and then you go in the door, because you have to think about the chain of infection. So I'm now in the room. I've put on these because I have a bodily fluid exposure. And I'm okay to do whatever I'm going to do, whether it's emptying a urine bag. So when I'm taking off my PPE, and just if I'm in the room talking to someone, I can't be doing this, okay? I can't be doing this. I can't be doing this. I can't just check the phone and say, I'll ring you back later. I can do none of that. When gloves are on me, they're single use. They're not for you to touch any part of your body. They're not for you to cough into your hand. So once they're on you, you can't touch anything else. And that's the way we do it every single time. And as soon as we're finished the job that we have them on for, they come off. There's a 2 on a single use item, and gloves are single use. They have the 2 with the arrow through it. So when you use gloves, they're for a single episode of care. So if I'm inside in a patient's room and I'm changing a pad on the patient, I then don't go and say, would you like a cup of tea, John? Or I don't go and say, would you like me to do your teeth, John? And I've changed their pad. So the gloves come off, they're the first to come off. So they come off, immediately I'm finished with the pad, and before I continue the care with the rest of the patient, even if it's one patient, I don't leave the gloves on while I'm continuing his care. They come off because these are contaminated. You may not see them being contaminated, but they are contaminated. And then we bin them appropriately. I'm going to pretend there's a bin here. They're in the bin, and what do we do then? We do our hands again. And we put on another pair of gloves if needs be. And that's what really is really important, that we don't put on gloves, do all the care of a patient, run out the door and go into the next patient, or run out and get supplies with the gloves on or the apron on. So it's single use, and we do this every single time. So this is only a bodily fluid. If you're going in to give someone medication, obviously you don't need gloves or an apron. So, and again, the hand hygiene after the gloves, because we can't guarantee that there aren't microscopic holes in the gloves. So gloves are never stored in your pocket. They're never used on more than one patient. They're never used for more than one episode of care, which in this case is, say, changing a pad, or if you're going to then go and do any other episode of care on that patient, you need fresh gloves. So I've taken off my PPE, I've done my hand hygiene again. So now I'm going to talk about sharing personal equipment. As much as possible, we absolutely shouldn't share personal equipment, because once my bacteria is on it, and I give it to someone else, I'm also potentially giving them my bacteria. So we try and keep personal equipment separate. And for disinfectant cleaning, remember The disinfectant of the area has to be thorough, and the concentration of the solution that you're using has to be accurate. So first of all, a bit of background on the virus. As you all probably know, it started in China towards the end of 2019, the end of December. That's why it's called COVID-19. And now it's reached every part of the world and we're in a pandemic situation. It's a virus, and it's a respiratory virus, and it's spread by droplets or areas that are contaminated with the droplets. So for any infection prevention and control intervention, we need good hand hygiene. So I'm going to demonstrate to you now what good hand hygiene is. And first of all, for good hand hygiene to take place, we need to be bare below the elbow. So bare below the elbow means bare below the elbow. And this means no jewellery, no watches, no Fitbits, no painted nails, no false nails, and clean nails. So this is the way we should be going into all our service users and in a clinical setting. So bare below the elbow. And for us to do good hand hygiene, our technique needs to be good. So for technique, we need to cover all surfaces of our hands. And soap and water, by the way, is absolutely fine. I use soap and water at home, but in a clinical setting, hand sanitizer is convenient. But soap and water, just to know that it is absolutely sufficient to decontaminate your hand. And actually this virus, there's a lipid coating on it, and it actually will disintegrate when you work up a lather in soap and water. So there's no reason not to use soap and lather if you don't have the sanitizer. But for this demonstration, I'm using sanitizer. Get a proper amount of the sanitizer or the soap and water, as I said, liquid soap and warm water. Rub it into your hands. Don't be sparing it, because if you're not using enough, you're not doing it right. So it's hand to hand. Get the webs of your fingers, the backs of the hands. The cuticles can get hard and ragged, and they can collect the virus and bacteria. So make sure you're covering. That's why you need clean nails, no nail varnish or anything there as a barrier. Get the fingertips, have to go in here. The fingertips, they're the guys that touch everything. So you make sure all your fingers, thumbs included, are in here. Do your thumbs. Okay. Backs of the hands, as I said. So keep doing that 20 seconds. The wrists need to be done. And that's hand hygiene. When you know that you've had enough of the liquid on your hands, that you've used enough friction to dislodge this virus, because the viruses, as I said, are in the crevices. So it's really important that you use friction. So that's hand hygiene. Now your hands are decontaminated, okay? And you need to do this every time you go to touch someone, or if you touch the environment and go to touch someone, or if you're going to eat. So this is hand hygiene. Nextly, we're going to talk about cough etiquette. And it is a droplet virus that's spread by droplet. So the difference between droplet and airborne is that droplets, if I cough, within the 3 feet zone, your cough will normally, the droplets will drop to the ground. We say 2 meters as a safety in case someone had a big sneeze, but that's the difference. If it was airborne, I could probably reach the back of the room if I had something that was contagious and airborne, it could reach the back of the room. But this is droplet, so that's why we say the 2 meter zone. But be aware that everything in that 2 meter zone could potentially be contaminated when we cough or sneeze. So cleaning is an important part of controlling this virus. So for cough etiquette, we say into the elbow or into a clean tissue, and I mean a single-use clean tissue. The children of Ireland were fantastic in the H1N1 pandemic. They were all taught by their teachers wonderfully to cough into their elbows, whereas unfortunately adults, as children, we were all told to cover our mouth and cough into our hands. And still, it's a problem for some people. They do, out of habit, cough into their hands, but we need to break that habit. It's really, really important. As I said earlier, if we're touching people with fingers and with hands and we cover our face, that virus is on our hands, and the virus does live outside the body. So we can't be coughing into our hands unless we have a clean tissue, and the tissue is disposed of right away into a bin, and then we do hand hygiene for 20 seconds, and that has to happen every time. And it can be difficult, especially now when we're all told to go out walking and get air, that people can touch their noses. So be careful of that when you are in the outside, that you're not touching your nose as you walk, because the virus could get onto your fingers, and then anything you touch, you could be spreading it. So that's cough etiquette. It's into your elbow if you don't have a clean tissue, and if you have a clean tissue, you use it once and once only, and you bin it and you do your hand hygiene. And boxes of tissues around that are convenient will help with people complying with this. And we need to be comfortable to pull each other up on our hand hygiene and on our cough etiquette. So if someone out of habit coughs into their hands, we should be okay with saying, listen, you just coughed into your hands, and say, oh, do your hand hygiene. So we need to pull each other up on it gently. As I said, any habit is hard to break, but we don't really have time to learn to break this habit. We need to do it as quickly as possible. The healthcare workers that came to the training told me about in the schools that they're teaching the school children very effectively on the virus before the schools all broke up, and they were using the dab that was very popular all over the world last year, but they were told, like, wash your hands, don't touch your face, and cough into your elbow. So maybe that's something that you could bring home to your kids, or maybe they're bringing it back to you. So that's cough etiquette. The next important thing is not to touch your face. So we need to look at our face as an area of non-touch. And when I talk about my face, you talk about this whole area, because we don't want this virus, which can get in through your eyes, your nose, or your mouth. So we could touch something, very casually touch our phone, we could touch our keys, touch a keypad, and then touch my eyes, or touch my nose, or touch my mouth, and I can take in the virus that way. So we need to look in this area as a protected part of our body. Also, just to remember that first thing in the morning when you get up, it's also equally important to wash your hands before you touch your face. So when you get up in the morning, before you touch your face, go in and wash your hand, and the whole family goes in and washes their hands. That's important. And for service users, anyone that's in residential care, if you can get them to do their hand decontamination before they eat their breakfast. All these tiny tips are really, really important, because we are trying to halt the spread of the virus. And it's literally, if we did our hand hygiene, our cough, and don't touch our face, and now we're going to talk about environmental cleaning. So disinfectant cleaning, as per usual, will take care of this virus. And as I said, the virus is, for any of us in our workspaces, we have to worry about our work area, as in the 2-meter zone around us. So anything there, like your computers, your PCs, your telephone, your keypad, your bottle of water, if you have any food. And really at this time, eating maybe in a shared environment is maybe not the best idea. Just to be careful that you have to know that the food you're putting in your mouth, that the water you're drinking is not contaminated. And the same goes for anyone that is helping people in their homes, like home helps or public health nurses going into people's homes, that anything that you're putting into someone's mouth has to be clean. So we don't want to be handling food without very clean hands, okay? So it's very important that we decontaminate the environment appropriately. Just in relation to attire, I suppose, when you're going into people's houses, I mean in your work life, that you don't maybe bring in coats, handbags and scarves and the like, or even, you know, these tabards hanging out, but maybe it's better off down here, because everything is that you bring in is open to contamination. So you're better off to be going in, not bringing a whole load of stuff. As I said earlier, just bringing in what you need. But clothes-wise, I wouldn't be bringing in layers of clothes with you. Leave them in the car, in the boot. So don't bring in anything that you really need to bring back out if you're bringing in, as I said, in the line of dressings or such. So again, for a lot of public health nurses and maybe in the community, just consider where you're eating your food, that you have to be sure that you're not inadvertently touching steering wheels and keys and your phone, which can be contaminated. All of these things could be contaminated with the virus. So be very careful if you are eating on the go, that you are eating in an area that is clean, and that your hands have not touched and inadvertently touched areas that could be contaminated. So again, as I said, it's the same. Good hand hygiene for 20 seconds using friction. This is so important. It's probably why I keep reiterating it. You need that bit of friction to loosen that virus, to get rid of it. Just little tips, maybe that you're not sharing pens, because pens go into people's mouths, that you all use your own pen, that you're not leaving phones down in surfaces, because looking clean and being clean is very, very different, as we know. So something can look clean and someone could have sneezed all over it 5 minutes earlier, and it could have dried in and you won't see it. So just be aware of that the first thing you do when you go in the evening into your house is that you go straight and do your hand hygiene, that anyone in the house with you, they go straight and do the hand hygiene, and the towels are renewed frequently, and rolls of paper towels are handy as well, but your phone as well. Just think, you have to think broader, and I know you're very inventive as healthcare workers. You're solving problems every day, and you're all used to your environment in the community, so you just need to be aware of these little extra steps. So it's hand hygiene before and after entering anyone's home. It's hand hygiene before entering your own home. It's hand hygiene when you get up in the morning. It's hand hygiene before you eat, before you put anything in your mouth. This is the protected zone, okay? So if you're giving anyone tablets or helping anyone eat, your hands need to be clean, and you wouldn't be putting bare fingers into someone's mouth anyway. If you're doing tablets, put them into the lids of containers, not into your hands. If you have to put tablets out for some of the service users to help them, and some of the home helps are feeding people, you need to have clean hands. But if anyone's getting tablets, they should really put them on a plate, maybe into their own mouth, that people aren't helping them with medication. Just to tell you about the two wonderful websites that we have. We have the HSE website and we have the HPSE website. So if you into Google search, put in HSE space COVID-19, that's COVID 19, you'll get all this really, really good, up-to-date current information on the COVID-19 virus. So the other fabulous website is the HPSC, that's the Health Protection Surveillance Centre. And if you put into Google search HPSC COVID-19, again, you'll get all this fabulous information. And there's videos there about putting on PPE, that's personal protective equipment, and it shows you that if you did need to use this equipment, all that technique is there in videos. There is another video about if someone presents themselves with symptoms of COVID virus and you weren't expecting them to come to your place of work, what you would do. And it's important to remember that you're not alone. None of us are alone in this, okay? And if you have to deal with someone that is symptomatic with COVID-19, the signs and symptoms are, as you will know by now, it's like cough, any cough, a pyrexia or shortness of breath. But also be aware that there may not always be a pyrexia, that it can be very mild flu-like symptoms. So if somebody is having unexplained respiratory symptoms, we need to be thinking, could it be COVID-19? And always seek advice, whether it's their GP advice, it could be public health or occupational health, or us, the infection control nurses. We're all there to help, and we are all there together. So everything that I tell you here today, there's a ripple effect. This information can be applied at home, it can be applied in work, it can be applied with your friends. It's basically we're all working together as a ripple effect and spreading out to reach, because it is going to be, as we all know, it's going to be all of us together working on this. Social distancing is very important. So when you're out walking and getting air, it's very important that you're not all huddled together. It's important that you're not eating food when you're out if your hands aren't clean. It's just, we have to really think about this virus, that it's very easily spread. But on the upside, it's actually easily controlled if we do the right thing. So it's washing your hands, don't touch your face, and sneezing into the elbow or into a clean tissue. And as I said, we need to look at these two websites. We need to keep up to date. The information changes sometimes daily. And so it's HSE and HPSC. And if you put COVID-19 into the bracket after them, this will come up. And remember, this little guy, this finger, we go around touching ATMs, lift buttons, we go on our computer, our keyboards, all of these things need to be cleaned, and we can control our work environment in just cleaning them as we use them. And also when we're out and about, just be careful with your fingers. Maybe use your knuckle on an ATM, use your card for contactless payment if possible. But it is, remember, this finger, anything you touch with a finger is highly likely to be contaminated, if not with viruses, with other bacteria. So if you touch anything, you need to clean your fingers. And I said maybe a knuckle will help you, give you the few minutes before you go and do your hand hygiene, that you're not inadvertently going to touch your face or your nose. Any of the little tips and information that you have picked up in this, if you share it among your service users, share it about the people at home in your life, because little simple things is what will control and contain this virus. So as I said, something simple like not sharing pens, cleaning your work environment, being aware that droplet spread is within that 2 metre zone, being aware that when you're sitting people at a table, that you keep the space between them, that maybe instead of 6 at a table, you're 4 at a table, and just doing things differently. That we need to adapt, and we are adaptable. Like, we're very adaptable. Every day is a different day in a healthcare worker's life, but now we can be inventive, we can be actually creative, and we can actually feel control, because in these times you can feel out of control. And even me making this video, it gives me back some control. I feel that I'm able to help, and I know each one of you there want to help. So all the information here, please spread it. Please do the simple things like boxes of tissues around the place. Correct each other if you sneeze into your hands, because it will happen, okay? When people are tired and stressed, they revert to habit. Do we clean our hands immediately we go into houses? If someone didn't do it and came to the house, ask them to do it. Expect others to do it and expect yourself to do it. Don't inadvertently touch your nose. This kind of stuff will help. It's really important. And when you're down in the shopping centre, help people keep their distance. If you are young and healthy, you can step back and protect the vulnerable that are down there shopping, protect the children that are around, and just basically be kind to each other and use this information. It's to be used by everyone, not just by you. So I hope this is helpful for you. Thank you for your attention.